So John is a 53-year-old who is in the acute inflammatory phase of healing after stepping in a hole in his yard a few days ago. So he has inflammation on his lateral ankle. Indications for using ultrasound to treat this patient would be that this is an acute soft tissue dysfunction, and ultrasound has been known to enhance the healing process and also increase blood flow to that area. So let's meet John. Hi John, my name's Emily. I'm going to be your student physical therapist today under the observation of Dr. Clausen. So we're going to use ultrasound today, if that's okay with you. Have you used ultrasound before?
No.
No? Okay, so I'll tell you a little bit about it. So it's this machine right here, and what it is I'm going to, over the inflammation on your ankle, I'm just going to use this little wand and kind of put some gel on it, and then we'll go over the inflamed area. We're going to do this because it increases blood flow to the area that is inflamed, and then also because it's supposed to help with tissue healing and bone healing.
Okay.
Does that sound okay to you?
Yeah.
Okay. So we're going to turn the machine on. And ultrasound uses sound waves to penetrate the tissue. So we're going to click on sound. And then for our frequency, we're going to choose 3 megahertz because the ankle is his injury is more superficial, and the ankle has less soft tissue there to penetrate. So this will be more superficial frequency. And then we are going to use 20% for the duty cycle because we want it to be non-thermal since he is in an acute inflammatory phase and we don't want to increase the inflammation. And then for our intensity with these settings over here, we would do 0.5 to 1. So I'm going to start at 0.5 since he has never used ultrasound before. And then our time would be about 5 to 10 minutes. So we're going to leave it at 5. All right, John. So, do you have any questions for me before we start about ultrasound?
No.
Okay. So what we're gonna do is is it okay if I take your sock off?
Sure.
And then I also want to check your sensation on your ankle.
Okay.
Since you have diabetes, correct?
Yes.
All right. So I want to check. Have you had any? Do you have sensation in your feet from?
Pretty sure.
Pretty sure it's all good. Okay. Well, is it okay if I feel the area to kind of check and see how your sensation is? Okay. Can you feel this?
Yeah.
Okay. Good. How about this?
Yes.
Okay. Good deal. And do you have any like other issues in your ankles? Blood flow issues? Okay. It looks good to me. It's a little sore there.
Cold.
Cold? Sorry, my hands are cold.
That's fine.
Okay. So what we're gonna do first, this is actually even colder than my hands.
Okay.
So it's a gel that we put on the head of the ultrasound machine, and so that it kind of has a buffer between your skin and the head of this.
Okay.
And then also the head of this is the ERA, the effective radiating area, and I'm only gonna do about 2 to 3 times as big as this
Okay.
area around your ankle. Okay?
Okay.
All right. Okay. So it's gonna be really cold. Slowly. I'm gonna get this going. Get it kind of spread out a little bit, and then I'll start the machine. So it should not feel any discomfort or anything. Yeah, actually, I'm gonna grab a towel before I start. Okay. Can you lift your foot up for me? There we go. So there shouldn't be any pain. So if there is, please let me know and I'll shut the machine off, okay?
Okay.
Does that feel okay?
Yep.
shut it off and we're all done. Okay. How'd that feel?
Pretty good.
Pretty good? Okay, I'm gonna wipe all this off now. Oops. Check that up for me. Okay. So now we can get started with the rest of our treatment, okay?
Okay.